Hello, Ms. Johnson. Welcome to my presentation on pneumonia. I hope you're doing okay. I hope everyone's safe and that you're enjoying your time away from us. I'm sure you are. Um, all right, let's start. I did pneumonia. It's an infection that attacks the alveoli in the lungs, so that's the main part of the respiratory system that is being attacked here. Um, it causes coughing with phlegm or pus. The phlegm and the pus is actually what's the main like catalyst for this whole thing. It blocks up the alveoli, which makes the gas exchange difficult or like non-existent. So it also causes difficulty breathing. But we'll get into that. I'm gonna talk about that more later on. Um, yeah, and basically the main causes are viruses, bacteria, and fungi. But that's also one later on, like right here. Here we go. Um, the causes and risk factors of pneumonia. Pneumonia is classified by which germ causes it. So we have bacterial pneumonia, fungal pneumonia, and viral pneumonia. And each one comes with different things. Maybe some are more serious than the others, but that's basically how you're going to be able to identify it. The most common one is a bacterial pneumonia called Streptococcus pneumoniae. So if you hear somebody has pneumonia, most likely it's going to be that one. There are other ones, but we'll get into that later as well. Some risk factors, obviously chronic health problems. You're more likely to get pneumonia. You're more likely to get any disease with chronic health problems because of your immune system being weakened. But yeah, also, if you are 2 years old or younger, you're going to be more at risk, and also 65 years and older, because I guess when you're young, your immune system hasn't fully developed, and when you're old, it's starting to go down the drain. So there's that, and also smoking is going to be a risk factor because you're damaging your respiratory system when you're smoking, so it won't be able to fight against the infection as well. Also, being hospitalized, there are lots of cases of like hospital pneumonia because of sharing breathing equipment and everything, so there's risk in that. And like I said, chronic problems. All right, these are some other types of pneumonia. Um, these are all bacteria. These three things are all types of bacteria that cause atypical pneumonias. So first we have Mycoplasma pneumoniae. Yeah, all right. Which is typically referred to as walking pneumonia. It's just a very mild type of pneumonia. Like with regular, you're gonna be like bedridden. You're not gonna be able to get up and go out. You're sick. But with walking pneumonia, it's like people go out and go to their jobs, go to school with walking pneumonia because it's not as serious. Then we have chlamydophila pneumonia, which, contrary to what I thought at first, it's not caused by chlamydia. It's just the name of the bacteria. I guess they decided to name it something similar. I don't know why, but this bacteria in itself is a respiratory bacteria, which means like it usually is causing coughing or whatever, but this can also, one of its side effects or whatever, can also cause a mild pneumonia. And the last one, Legionella pneumonophila, is what we call Legionnaire's disease, which I'm sure everyone knows that. I know you know it, but yeah, basically this is the most deadly type of pneumonia. And it's not spread from person to person. It comes from contaminated water. So that's how it's a little different from other pneumonias. Next is how it affects the alveoli, like I was talking before. So the pus is the main thing you should focus on here, which is it's an inflammatory response. So your body realizes that you have pneumonia, that the bacteria is there, which causes pus to build up inside of your lungs, and that pus is going to go into the alveoli, actually there's a picture on the next slide I'll show you in a second, but it actually invades and fills up the alveoli with this pus, with this mucus, and that limits the I don't know, space inside the alveoli for the oxygen to be in there. Look, I'll go to the next slide. Here you can see what I'm talking about in the bottom picture. The fluid is filling up inside of the alveoli, and it's going to make gas exchange difficult. It's going to make it so that it's slowed, that your blood isn't getting as much oxygen as it should be getting, which is why this is kind of serious. Let's continue. It doesn't only affect the respiratory system, which I didn't know. I thought it was just your lungs, but over here we can see some other ways that it affects your body. I guess start with the respiratory system. You got the coughing, difficulty breathing, which is what I was talking about with the gas exchange. It's going to make that difficult, and you're obviously going to cough up some of that pus. And yeah, that's it for respiratory. But then we're going to move on to circulatory. Now, I didn't know this. It's going to cause a rapid heart rate, which is not good, as we covered in a few lessons ago, a few units ago, with your heart and everything. And then bacteria from your lungs can actually enter the bloodstream with like the blood barrier or whatever we were talking about with the capillaries and instead of oxygen going into your bloodstream like it should, a little bit of oxygen is going to go in, but also the bacteria is going to go in, which can cause it to spread to other organs and could be fatal. And it also puts you at higher risk for a heart attack, which nobody wants a heart attack. Next, we have muscular. The muscular system is going to be affected by weakening your muscles. When you're sick, your muscles are weaker, and it's also going to give you fever and chills, which I might have said before, but I might not have, but that also comes along with pneumonia. Another part of your body that's affected is your digestive system, so it's going to be nausea and vomiting. Sometimes there's side effects. I put sometimes because really this is only seen in patients where it's viral pneumonia and it comes from the flu, because nausea and vomiting are symptoms of the flu. So if you're getting pneumonia from the flu, then you're gonna have nausea and vomiting as symptoms as well. All right, now what is your doctor gonna do to find out if you have pneumonia? First, he's gonna take a blood test, which what that's going to do is it's going to tell him if you actually have pneumonia or not. So if you do have pneumonia, next thing he's going to do is going to take a chest x-ray to determine where the pneumonia is, in your right or your left lung, or where in the lung is it, which alveoli is it infected. And once he sees that, he sees that it's there, he sees where it is, he's going to take a pulse oximetry, which is going to measure the oxygen level in your blood. That's important to know how severe the pneumonia is, and other stuff like that. Then the final thing he's going to do is a sputum test, which is he's going to have you do a really deep cough and then sample the fluid inside of your lungs. I didn't actually know that was a thing until I read about it today, so it's pretty interesting. Once he figures out that you do have pneumonia, what are you going to do? Basically, just really simple stuff. Antibiotics, which are going to treat the bacteria, then cough medicine and painkillers for your immediate symptoms. But really, unless you have serious symptoms, the only thing that they're going to do is prescribe some antibiotics for you. Hold on. Sorry. And again, if you have these serious symptoms, or if you're over 65, you're gonna be put in the hospital. Like if your breathing is just terrible, if you can't breathe, if your heart rate is too high, all that you're gonna be hospitalized for. And yeah, that's about it. These are the sources. I want to take a look at those. And thank you.